Hi there, Dr. Grodski White Rock Naturopathic. I want to talk to you today about ketogenic diets and the hCG diet. Many of you have heard of the hCG diet. It was a diet designed by Dr. Simeons back in the 50s, and it was a very novel idea at the time. It involved using human chorionic gonadotropin, which is the pregnancy hormone, in order to affect weight loss. It was combined with a very low calorie diet, 500 calories, and one needs to remember that at that time, back in the 50s, we didn't know nearly what we know nowadays in regards to the differences between calories, proteins versus fats, and carbs. Ketogenic diets were known of at the time. They were used therapeutically, epilepsy and other conditions. However, not for weight loss necessarily. So it's quite groundbreaking that Dr. Simeons tried to encourage ketosis through the beginning of the diet, the loading phase. What he was trying to encourage was switching over to ketosis by encouraging more of a fat, eating of fat in the very beginning, followed by a low-calorie diet, which some might even describe as intermittent fasting, because with the 500 calories that one's allowed, a lot of people would just have 2 meals per day and go for a duration with not eating. And so that was to further impact the ketosis. Carbs weren't talked about too much, but in general, at 500 calories, you're not really consuming all that much. And so, in general, the diet part, you could say, was a very low-calorie diet that didn't necessarily emphasize fats. It was very fat-free. Being 500 calories, you don't really have much room for the fat. However, ketosis was the goal. And the hCG, which is used for 3 primary reasons. It's an appetite suppressant. It stimulates leptin and re-establishes the proper usage of fat as a source of fuel. And secondly, it supports energy during a low-calorie diet, which means that your metabolism doesn't adjust, and weight loss is consistent over the period that one is pursuing the diet and using the hCG. And thirdly, muscle mass is protected, which is an under-mentioned benefit of hCG. Majority of diets, especially those that are calorie conscious, one can lose quite a bit of muscle if protein isn't focused on, and sometimes it can amount to 50% of the weight loss that one has. And so low-calorie diets, as well as low-carb diets that aren't making use of hCG, may be in turn causing an individual to lose some muscle. So 3 benefits, again, of hCG are: number 1, it's an appetite suppressant at the appropriate dose, and it does that through acting on leptin, which is your main weight loss controlling hormone. Number 2, it is a form of energy support for your endocrine system, preventing your thyroid, your adrenals, your cortisol, your blood sugar from adapting to a low-calorie diet and causing your metabolism to change. And thirdly, a protectant for your muscle mass. And so we have the hCG diet. Traditionally was a low-calorie diet with the combination of hCG. What we're doing here at the clinic is we're using what we know currently about clinical nutrition and adapting that to weight loss goals of our patients. hCG is a very useful tool in being those 3 factors. However, the diet is where one can find greater or lesser success. Initially, when I first started using the diet with patients more than 10 years ago, I was following the Simeons diet, the original protocol, but it had certain risks and concerns that I didn't feel entirely comfortable with using. The low fat aspect, the low calorie aspect, is a concern for gallbladder attacks or developing gallbladder stones. It's stress on the body, and without getting sufficient amount of fat, majority of people don't feel quite right. And so I very quickly went from the original diet and focused more on a low carb, higher protein approach with the addition of some more calories. So it was a 750 calorie diet, 30 grams or less for carbs, and that is what I've been using for the last number of years with great success. However, there is the occasional individual who finds it very challenging to reintroduce calories afterwards, being on a low calorie, low carb diet. And of course, there are some people who don't get into ketosis and simply dropping down the carbohydrates. It's simply not enough for many people, if not the majority of people. And so that is where the macros comes in. The macros are the ratio of proteins to fats, the actual percentage in your diet. And that is where a lot of people would benefit from higher calories, higher fat intake, while maintaining the carbs at a low level. And so that is where our current interest is in terms of weight loss, is adapting the macros to individuals based on their weight loss history, on their individual needs, their degree of exercise and activity, and how much weight they have to lose. Those all play a role in determining whether a low carb, higher protein diet or a more higher fat ketogenic diet would be effective long term for weight loss. So I hope that's been insightful or educational, and thank you very much for watching. If you have any interest or questions, please contact the office at White Rock